Good morning, good afternoon, good evening, wherever you are in the world. I'm Paul Elam with a voice for men and an ear for men. And today we're going to be talking about a very touchy subject, testicular cancer in men. Of course, that goes without saying. But one of the things that struck me before even entertaining the idea of doing this talk is that, even as a men's advocate for over 35 years now, I don't recall that I've ever had more than a 10-second discussion about testicular cancer. It's just something that even men's advocates don't talk about that much. And that's part of what I want to dig into today with this discussion. I am joined by Brian Martinez of the Honey Badger Brigade. Hi, Brian. How you doing?
I'm doing very well. Thank you, Paul. And thanks for having me on.
It's really good to have you. I am also joined by Mike Craycraft, who is the founder of the Testicular Cancer Society. Mike, welcome.
Thank you. Thanks for having me.
Really glad to have you here. In case you didn't know, Brian has been affected by testicular cancer and has just undergone treatment. We're going to be getting into some of that. But first, I want to take a little bit more of a global approach, and starting with you, Mike. You've been in the trenches, as it were, trying to bring attention to this problem, trying to get funding, I'm sure, for more research and other advocacy efforts. I can't imagine how difficult that's been. And I'm going to assume that getting interest in testicular cancer has been difficult. Is that pretty accurate?
Yeah, I think difficult would be a good word.
Okay, and so what are some of the problems that you encounter?
Well, I mean, it really, when you start talking about testicles, it is somewhat of a taboo subject, the same way that breast cancer was 30 years ago. There just hasn't been that many people that want to start a conversation, and be a part of it. So it just makes it, rough.
Yeah, and to be fair, I've done a little bit of research, and in all fairness to all the cancers that people are affected by, testicular cancer is not a particularly widespread cancer. Can you tell us what generally the incidence is in the general population for men of this disease?
Sure. So in their lifetime, a male's risk of developing testicular cancer is about 1 in 250. There's about 9,000 or so guys diagnosed a year and about 350 or so guys that pass away each year from it. Compared to, say, prostate cancer, the numbers are very small. But particular to testicular cancer is that when a young man passes away, he loses on average 37 years of life. So there's a lot to look at besides just the hard number of incidents.
Okay, and I'm sure even though it might be considered sort of an orphan condition without a high incidence, that it certainly makes an impact on those who have it. They don't feel like, now I can compare this to something. I just went through my partner having endometrial cancer and getting treated for that. And even in her support groups, there was a lot of questions about, where's my pink ribbon? Where's the awareness about endometrial cancer? I can imagine that with testicular cancer, it's even more profound, mainly because it happens to men. Do you think that's a fair assessment?
Well, and majority of the time it happens to young men as well. So, young men can be like trying to herd cats, and trying to get their attention can be difficult.
Okay.
Yeah, it can affect adolescents. So you have very young men getting it. Is that right, Mike?
Yeah, it's the leading cause of cancer in guys 15 to 35. It can occur at any age. We've helped just last year a mom who had a 9-month-old with it to a 78-year-old male. So it covers the spectrum, but it usually hits around the 20s and 30s.
And you say 15 to 34, it is the #1 cancer?
Correct.
For young men?
Correct.
Wow. Okay. Well, let's get into a little bit more. on this. I mean, we could talk numbers and we can talk, the types of cancers, and I want to get into some of that, the aggressive versus the non or less aggressive forms of it. But there's also I am assuming, and Mike's going to be the authority here, or rather, I'm sorry, Brian is going to be the authority here. There's also going to be, let me just put it flat out to you. What was it like for you hearing you have testicular cancer?
It was, well, I can tell you the story of how I came to learn about it. I would say that, so what happened was, I went to the ICMI in London a couple of years ago. And when I got back, I started to feel, a swelling in one of my testicles. I noticed that it was like pretty swollen. It was kind of painful, like a soreness. I didn't know what it was. And for a little while, I decided that I would wait because I thought maybe I pulled something or there was just too much pressure because the flight back from London was, the longest I'd ever been up until that point. And I was squeezed between an Indian couple that didn't want to get up. So I just stayed in my seat the entire time. And I thought maybe that had something to do with it. So I thought, man, it'll pass, it's only gonna go down. And it didn't. And it continued to irritate me. And my fiance at the time, she usually jumps to the worst possible conclusion. She was like, oh, it could be cancer. Maybe it's a tumor. And I'm not that way. I was like, oh no, it's the likelihood of that is so slim, because I looked into it and it was like, it's pretty rare. And I figured it's probably not that, but there's a number of other things it could have been. So I waited a little bit longer. I saw that nothing was changing. I went to my local hospital right up the street because I couldn't even sleep. It was really bothering me. And they got someone to do a ultrasound. And what the hospital originally told me was it's orchitis, which is an infection that you can get. There's a bacterial and a viral version of it. So they told me it's just orchitis. Here's some antibiotics. You'll probably be fine. And I said, okay, good. And I told, my fiance it's just orchitis. And she was like, oh, I guess it's nothing to worry about. So I took the pills and I thought there was some improvement, but I could have been psyching myself out. And I think it's because ultimately I really didn't want it to be cancer, right? And because the hospital told me it was something less severe, I bought into it. So when the time came that I saw there were no improvements, nothing was changing, and I was feeling worse, and I decided to go to the emergency room at a different hospital, that was when they determined it was testicular cancer. And when they told me that, I felt and then like this weight just fall on me, because I was like, holy shit, what does this mean? I didn't know how what the survival ability was on that cancer. There was just a lot of mystery and more questions, and there was this sense of I don't know, like I wish I had known this sooner, kind of a thing. So it was pretty serious. But Mike, haven't you also didn't you also have testicular cancer? Are you not a survivor too?
Yeah, I was diagnosed as well. My story is a little bit different. I felt a ridge just when I was adjusting myself, and immediately in my head thought that it was cancer. But instead of going to the doctor, I just remained silent, didn't share it with anyone, friends, family, and basically lived like I was dying for 7 months until I figured, well, I better at least go get diagnosed, because if I pass away from this, I had convinced myself I was going to. And my parents find out I never went to the doctor, they're probably going to be a little bit angry. So 7 months later, I finally went in and amazingly was still diagnosed at stage 1.
Let me ask a question for the both of you. And thanks for sharing that, Mike. I was not aware that you were a survivor of testicular cancer. But was there anything about it being testicular cancer that made you more hesitant to pursue it, that maybe made you more tentative about trying to get to answers? Would it have been different if you suspected that you had Hodgkin's or some other form of cancer? Was there a component to this that just feels different? If you could both answer that.
I'll go first. Yeah, I think so. I think that the fact that it was affecting my testicles made me a lot like more I don't know, afraid to talk about it. I think that's true of a lot of men who have that. It's like it is something about it being the testicles that makes it personal. Like before this happened, I remember years ago, so before I got involved with all this men's rights stuff, when I would hear stories about other men getting testicular cancer, such as Tom Green or Armstrong, the cyclist, I remember that telling jokes about it was actually something that just came natural to do. We'd find it funny, and maybe it was a way of sort of coping with it, but it was something that I was quick to joke about. And I think when I found out that it could have been me, it was hard for me to come to grips with.
Can imagine. Mike?
Yeah, the weird thing is that because it's a testicle and it's external, you're able to examine yourself. So I would examine myself at night and feel a lump and think I'm going to go and call the doctor in the morning, and then I'd check again in the shower and wouldn't feel it, and it would go on and off. I'd feel it sometimes and then I wouldn't. So I think that's a little bit different than, let's say I suddenly start, passing blood in my urine and think, oh, maybe that's kidney cancer. I can't really detect that myself. I'm going to have to go in and get checked out. I'm a clinical pharmacist by trade as well. So when you talk about idiotic moves, that's me feeling a lump, ignoring it for 7 months, despite being a healthcare professional. I think sometimes that's just the way guys handle things.
Okay, Mike, Brian talked about being misdiagnosed the first time he went in to have it checked. Is this a common issue with testicular cancer, the misdiagnosis or problems getting to early diagnosis?
Yeah, from the medical standpoint, I think there is, orchitis or epididymitis that can occur. There can be epididymal cysts. So typically you go in, if you get a physical exam, the doctor may think, oh, well, this is what I feel, and send you home, and not actually do the ultrasound, which is kind of a shame. The ultrasound's, non-invasive, no radiation, it's cheap. Really, if someone has new symptoms in their scrotum, I kind of advocate that just do an ultrasound. It's a piece of cake, and then for sure. Even then, it's not 100% perfect. But at least, there are no magic fingers, is what I call it. When the doctor says, okay, this is what you have. And it's like, really? Because how can you tell that from his fingers or her fingers, whatever?
Okay. So let's talk a little bit about treatment. Brian, if you don't mind, I'd like to focus on your case. And it's a lot more recent, and you are the one that's very familiar to our shared audience.
Yeah.
What was the progression of events that once you were finally diagnosed, and what process did they go through to determine, one, what treatment you would get, when you would get it? And let's start with that part of how the setup for treatment goes.
Okay. So once they determined that it was testicular cancer and that I had a tumor, the next thing was to, find out how far along I was. So they started with an ultrasound at the second hospital, determined that I had a tumor. Then they gave me CT scans, and they learned that I had tumors in my pelvis, my testicle, obviously, my pelvis, and in my lungs. So the first order of business was to remove the testicle that had a tumor in it, and then analyze that. I may be doing this a little bit out of order because it's been a while and my memory is a little spotty. But when they did it, they determined that I was stage 4 non-seminoma, so pretty far along at this point, and that there were, like I said, tumors in my pelvis and the lymph nodes, as well as in the lungs. And the next order of business was to essentially set up a whole program, a schema, as it were, to put me through chemotherapy and then surgery. So I did the chemotherapy, after they removed the testicle. The chemo was the way that it was all, you know, intravenous, and the way that it worked, because I think some places you can take pills for it, but this was all done intravenously. And what I was on was 3 different chemo, I guess, you know, products. There was bleomycin, cisplatin, and etoposide. I think I'm hopefully pronouncing that correctly. The cisplatin and etoposide were administered intravenously throughout my visits. I would go in 1 week, Monday through Friday, and get those injected for, I'd be in there for at least 3 hours, sometimes 4 hours of just getting this stuff dripped through. And then on Tuesday, they'd hit me with the bleomycin, which specifically attacks, essentially all this stuff attacks the fastest growing cells in your body because it's trying to attack the cancer cells, but you end up losing other things like, you know, you get numbness in your fingertips, your hair falls out, and the usual side effects. So the bleomycin was 1 large syringe, 1 push every Tuesday. And then the other stuff was like throughout the week for the first cycle. So 1 cycle, the way it works is 1 cycle is you get bleomycin, cisplatin, and etoposide for a week, bleomycin just being 1 day that week. And then the second week, you just go in for a shot of bleomycin 1 day. And then the week after that, you go in for 1 shot of bleomycin 1 day. And then that's the end of 1 cycle. Then the second cycle starts and you do the whole thing over again. And I had to do 4 cycles of that. And that was brutal. At first, it wasn't that bad, but by the time I got to the 3rd cycle, I was like, it was very difficult. You know, I just felt awful. You know, and when the 4th cycle ended of all of the chemo, they also had me on a bunch of pills too for various other things. Because I mean, the stuff made me constipated. It made me lose my appetite. I was on you know, I had to change my diet and so on. So once this was over, they had to set up the surgery. And I'll get into the surgery if you like afterwards too. But because they couldn't schedule a surgery sooner than about a month out, because I was going to Calgary for the court thing, they told me I had to do 1 more round of chemo, but I just did 1 week of it. So I did 4 rounds and then an additional week of the cisplatin and etoposide. And then I went into Calgary, and then I came back, and then there was the operation. So the surgery is called an RPLND, or retroperitoneal lymph node dissection. And I did that December 15th, so not that long ago. They create an incision from the base of the sternum all the way down to the pelvic bone, right down the front. They open me up, and they take all of my bowels and innards out and move them aside because I got to get into the lymph nodes, which are in the pelvis, and they have to cut out the cancer. So that was the most intense surgery I ever had. And I was, you know, I was knocked the fuck out from that too. Pardon my language.
We'll get over the language.
Okay. So I was out of commission from that for a while, and that took, I think, from December up until about 2 weeks ago, where I was able to kind of like, you know, at least do the Honey Badger radio show again and function somewhat normally. And even now, I still have a lot of neuropathy in my hands and feet, which means that my fingers are numb, or they have a tingling in them, and my feet, there are parts of my feet which are numb too, which are a side effect of, I believe, mostly the chemo, but it could also have something to do with the surgery as well, because I was off my feet for a while. So
I can imagine.
Yeah.
Well, let me ask you, Brian, during all this time, and that sounds like an incredible ordeal. It really does. One of the things that I've noted with men in the 30, 35 years that I've been working with them is one of the factors that complicates their treatments, their prognosis in a lot of ways, is that men end up a lot of times isolated, or feeling isolated anyway. They're not, and I'm probably going to get, you know, knives thrown at me for this, but men are not wired near as well as women for social support. during these kinds of crises. We kind of tend to tell each other, tough it out, hang in there, give me a call when you're better, that sort of thing. How is this for you on that level, on the emotional level, going through that sounds like a horrific surgery and these really, really, really stressful treatments that put a lot on your body. How did you keep your spirits up? Or did you?
Well, I did. I did the best I could. I didn't have a problem asking for help. So, and I think that I would, but I have to give credit to my involvement with, men's rights, talking about men's rights on the show and all that, because I think that that's part of what sort of put me in a place where I felt like I could ask for help and that I needed it. So, and I did get it. Like my mother and my wife were very supportive, and they were, always there to help me out, because I was unable to do anything for a good while after, especially after the surgery, and during a lot of the chemo, I was very weak. So they were immensely helpful, and I didn't have a problem asking for it. But there is something else that I found interesting that I wanted to bring up. I was actually thinking about bringing this up on a Honey Badger radio show whenever it became relevant. But since you asked me this, you got me thinking about it. One of the things I started to notice, and I don't say this to be critical of my mother or wife for it, but one of the things I noticed is that when I initially was diagnosed with testicular cancer, and when I initially started doing chemo, they would be extremely attentive. Like, they would help me get into and out of the truck when I would have to go to the hospital. They would get me whatever it is I asked for. They would constantly check in on me. They were very proactive in looking out for me and stuff. But something I noticed was that after a while, let's say when I was at the 4th stage of my chemo, they would become over time a little bit less and less attentive. Not because I don't think they care, but I think it's like, I don't want to act like I really know what it is, but it seemed to me that the longer I was in need of support, the longer that went on, the lower the proactiveness would become. Do you understand what I'm saying? So it would be like at first, for example, if my mother would give me rides to the hospital and drop me off because there's no parking there. And if I went on my own, it would just cost me like an arm and a leg to park there. So she would have no problem picking me up at 7 a.m. and taking me to the hospital every day for chemo in the first week. In the second week, she would call first to see if I still needed it. In the third week, I'd have to call her and remind her, hey, I need to go into the hospital, right? So, and of course they would do it every time, but I noticed it was like, I'm getting a little bit too meta here, but it was like, when in, let's say, ancient times, if there was a man in the tribe that was weaker, then people would slowly over time sort of distance themselves from him because he was becoming maybe less useful. And I was feeling useless too, because I think that that's just natural for me to feel that way. But I was feeling that I should be doing more, even though I needed help at the time. So I don't know if you get what I'm saying, but that was just something that I had noticed, but I didn't have a problem asking for help, and I was getting it overall.
I think I get exactly what you're talking about, and I want to swing back with a couple of ideas about that. But first, I want to ask Mike. I assume through the work with your society that you have dealt with more than just a few men who've gone through testicular cancer, and I'm wondering if anything that Brian was saying about his experience resonated with you in your experience.
Yeah, well, I think one of the things that he touched on and maybe didn't consider is what's called caregiver burnout, basically. And that, when someone originally gets sick, people taking care of them are putting in every ounce of energy that they can. And over time, when that caregiver is not taking care of themselves and only focusing all their attention on the other person, it eventually gets to the point where the caregiver just loses capacity to continue that. It's something we see all the time with, childhood cancer or, really vice versa. And even seen with me, to be honest, when I'm spending all my time literally helping guys around the world, and all of a sudden I look up and say, wow, I haven't gone on a vacation or done anything to live my own life in 9 months. You start to lose, with the burnout, you start to lose empathy, which can be a problem. A lot of times when you're just tired and worn down, you can go on a vacation, but when you actually hit that burnout phase, you actually start to lose empathy, and really helping the other person. So that's why we always advocate for the caregivers. You really got to make sure that you're caring for yourself just as much as the person you're trying to help.
I'll say amen to that. I think that what Brian was describing, I'm going to add that I think there's a little more to it than that. That certainly makes a lot of sense to me, though. I know that the years of advocacy I've done, I still get emails sometimes many times a day, always several times a week, from people looking for help. And I've gotten to the point where I can't even read some of the emails, because if you take up a position as an advocate and go after it and don't take enough care of yourself, you do get burned out. I do think also, though, that Brian touched on something with men in particular. We don't really, as a rule, have a lot of tolerance for men that are weaker than they're supposed to be. And I'm using that term weaker sort of not literally. But I know that even in the years I've worked with men who went through emotional crisis, like divorce or death of a loved one, that the tolerance for the people around them as those men went through grief waned really quickly. I've noticed in women, they're very good at circling the wagons around the woman, about making sure that she doesn't feel alone during the process of loss or grief. And with men, the reaction is typically very different. There is just a little less patient, I think. Brian, does that make sense to you?
Yeah. Yeah, I think both of those things make sense, because it could very well be a combination. Maybe because, Mike was talking about working with people for, several months in a row. And I can understand how you just get to the point where it's hard for you to even empathize with them, because you feel neglected. You start to feel like you've neglected yourself, and maybe there's a part of you that says, well, doesn't anybody care about me or whatever. But I do think that there's something to what Paul is saying as well, because this happened over, I still believe, a relatively short amount of time. Like, my chemo went from late August, I believe, through till almost Thanksgiving, which is only about 3 months. And I could see that by Thanksgiving, there were, when it was getting to at the end of the fourth round, there was a, almost like a, get up and do it yourself attitude. Like, like by now you should be able to stand on your own 2 feet and, do whatever. Can you take out the garbage? Things like that.
Man up.
Yeah. It was a bit of that. I mean, and I wanted to too. So the pressure wasn't just, coming from outside. Like, I was doing it to myself. Like, I was like, man, I should be doing something right now. I feel useless. Right. So.
Okay, well, hopefully you came through the other side of that and really figured out that you weren't useless. You were just sick.
Yes, that's what I figured out. I was just sick.
Okay, that's good. That's a good conclusion. Now, you were stage 4, and that's not what most people with a cancer diagnosis want to hear. And I know that's got to be really rough news. Mike, I'm curious, does this happen to a lot with testicular cancer diagnosis? Is it ignored or not noticed until it's advanced, or are most of them caught earlier than that?
Really, the majority of cases are caught earlier.
Okay.
Probably, 20 to 30% of the cases are more advanced, depending on the year. But most, even when guys delay a little bit, many times it's caught in the earlier stages.
Okay.
Although there was, in the past 2 years, there was a young man on the college campus who thought he was sick, went to the health center and collapsed on the bus on the way back and passed away. Basically, it had metastasized to his lungs. It wasn't the flu that he had, and he was actually diagnosed post-mortem. So there are cases where, another 17-year-old just a couple of months ago, there was he was pitching as a prospect for the Boston Red Sox in October and died in November from advanced testicular cancer. So there are cases of it obviously being more advanced.
Let me ask you something along those lines too. And I know that, as you pointed out, you had testicular cancer, but a lot of people have had testicular cancer and not gone on to form societies and to do what you've done in advocacy in that area. What do you think is the driving factor here for you? This obviously turned into sort of a lifestyle for you, even now that you're post-treatment, but you're still very involved. You're still pushing for answers and for awareness. What was there? Were you an activist by nature, or was this something that the cancer itself stimulated in you?
No. Even in college, I had to make up some of my volunteer hours. I wasn't the most, I was generous. I was a pharmacist at 22, so I would make donations and stuff, but I wasn't exactly going out and, working houses for the Habitat or whatever. It just struck me as a situation where, as a healthcare professional and a survivor, I thought I had a certain quality where, I literally can, for the sake of Brian, call the top testicular cancer doctors in the world and speak to them on their level, and then come back and translate that back to Brian so he understands what's going on. I just thought there was a unique talent. And so I thought, well, maybe that's what I'm supposed to be doing.
Well, good on you for doing it. It's a tough subject. Very, very hard to even discuss for a lot of guys. Very hard to discuss even for guys that don't have it. It's just one of those topics we don't like to talk about. It's easier to talk about prostate cancer, and it's probably has something to do with the fact that it's internal and it's not directly, one of your sexual organs. Because that is, in terms of your masculinity, it's a big threat. And as tough as it is, I want to go into that direction just for a couple of minutes with you, Brian. You had a testicle removed.
Yeah.
What was some of the emotional components that went on behind that? That has to be just this, like, oh my God, I'm going to have, and thankfully they're cutting out cancer when they're doing it. So I'm sure that softens the blow a little bit, but it's got to be hard to hear that you're going to lose that.
It was. One of the things that helped was I had to come to terms with the fact that what they were removing was not a testicle, because by that time, testicle wasn't doing anything anyway. It was gone. So there was just this cancer that was there, and they had to get that out. So I had lost the testicle well before they removed it. But the very next thing that I became concerned with was, is this going to affect my testosterone? And is this going to affect my fertility? Because I hadn't decided whether I wanted kids or not, but it was something that I was entertaining as a possibility. Unfortunately, because things were so far along when I was diagnosed, I didn't have a lot of time to decide whether or not to have kids. Like, I had, essentially, they said, we're going to put you through the chemo and then we're going to do the surgery. So if you want to have kids, you might want to consider freezing your sperm, freezing your semen or whatever. And there's at the University of Illinois, Chicago here, they have a facility that does that. But it was really expensive, and I hadn't decided whether or not I wanted kids. So I figured I had to kind of like I had to make peace with the fact that I'm not going to be able to, because I had to do this thing and I couldn't afford to freeze my sperm. So there was a lot going on. You know, I was thinking about kids. I was thinking about my testosterone. I didn't want to, you know, it to go down. I was actually trying to increase it because for a little while I was my diet, I felt, was affecting my testosterone because I was trying to avoid dairy, and I was doing a lot of soy products. So I that was in the early 2000s. So I'm like trying to turn that around, and then this happens. So those are my concerns. I was worried about kids. I was worried about my T levels, and I was worried about my fertility in general, whether or not it would affect my masculinity. I wasn't so much concerned with, say, you know, is this going to make me look weird, or am I going to be a freak or anything like that? Because only people who I'm really intimate with would know if I told them, or, you know, whatever. And I would have to assume that I could trust those people, you know, enough to share that. So those are my main, yeah, those were the things that bugged me the most.
So you weren't worried about your loss of male privilege?
No, I still have half of it, which is way more than most.
Yes, that's enough to rule entire kingdoms.
Yeah.
So there's always that. So, what is now the prognosis for you personally? I know this doesn't, it's different in each case, but I mean, you've had the treatment, lots of them. What are they telling you, or is your probable outcome from this?
They basically, the surgeon, who is an amazing woman, who worked underneath the best, I guess you could say, the best testicular cancer surgeon in the country, was this guy I was originally trying to get to work with me, and I learned that he doesn't do that stuff anymore. She got the home run victory, is what she told me, the best possible outcome for what my condition was. So all of the cancer has been removed. The stuff in my pelvis and the lymph nodes. As far as my chest goes, there's nothing there but scar tissue. So it appears that the chemo did its work as far as the lungs. But as with any other these sort of procedures, I have to go back every 3 months, I think it is, in the first year, for tests to make sure that it doesn't come back. And then the following year, I go back every 4 months, and then the following year, it's every 6 months, I think it is, and then, or something along those lines. And then if I get past all that, then I'm considered a survivor. So
Okay,
I'm cancer free, but I'm not a survivor.
not yet,
Mm-mm.
but with any luck, you will be.
Yeah, the surgeon says there's a pretty good chance that I'm probably fine, but they have to go through this, you know, procedure. So
Yeah, and that's one of the things my recent experiences in dealing with cancer has taught me, is that there's, in every kind of cancer, in every regime of treatment, and everything, there is plenty of uncertainty along the way about everything. You never do really get to this point where you get to say, I'm cured, it's over, and I'll never have to worry about this again. People that get cancer do have to track themselves and get checkups down the road. Mike, is there anything that men can do to catch this stuff?
Well, really practicing monthly testicular self-exams is the start. So we actually make it real easy. We have a free app for mobile phones. They just have to go to ballchecker.com. We sophomorically put it at that to get guys to go there.
Okay, by the time this is up, I'll have a link below to that, as well as to your Testicular Cancer Society website for guys that want to check that out. So you actually have some instructions for them to do self-exam.
Yeah, it's just a simple 3-step, process, and then they can also set a reminder to remind themselves on whatever day they want a month later. So really, the detecting it early, and then obviously if they notice any changes, lumps, bumps, firmness, one testicle is changing, then getting into the doctor, and that access to care issue. Then secondly, is a big thing, and certainly what helps with access to care is making sure that you have health insurance and can get in. So and then from there, if you are diagnosed, hopefully you'll come to us and we can help with the third big part of it, and that's quality of care. So, really it's a three-prong approach. You need the early detection, you need access to care, and you need to make sure that that care is appropriate and the best.
Is there any lifestyle choices that play into this that you'd recommend? And certainly, I mean, it almost goes without saying, people recommend, if you don't want cancer, start by not smoking. That's sort of a no-brainer. But is there any other dietary lifestyle choices that is known to have an impact?
I was thinking the same thing. I was wondering about.
Yeah, not really. There really aren't any lifestyle or choices that you make that really cause the cancer. There's actually just a study published this week. They used to think, exercise may cause it, like riding a bike, and they just re-looked at that and in a whole and said, no, there's no proof that any kind of exercise or, trauma is causing it. The only thing that slightly has been associated with it is marijuana use. But even then, it's not in a causative relationship. But if you're using marijuana, then it might make even more sense to make sure you're doing your self-exams, just out of abundance of caution. But there really aren't any, lifestyle choices or anything like that will prevent it. That's the problem, is we really can't prevent it. So it's early detection is where we shift to.
And sometimes the research itself has contradictory information. And I recently read one of the studies that pointed toward cannabis use and the incidence of testicular cancer. And while there was a positive correlation, the study also concluded those who used marijuana heavily were less likely to get testicular cancer than those who used it lightly. So strange and contradictory results. But
yeah, and that
Go
might
ahead.
have been the 2012 study where it actually shows that if you use cocaine, you are less likely to develop testicular cancer.
Yes.
It's probably the same article. There were basically 3 different studies that looked at it, and they all pointed to an increased rate in what's called non-seminoma, which was very interesting that all 3 of them pointed that way. It's certainly not saying that, if you use marijuana, you're going to get testicular cancer, but it's just something to keep in mind. As there's information showing that firefighters might be at twice the risk for developing testicular cancer. So, washing your gear and doing a self-exam every month is just something that in those certain populations, it's more important as well.
And again, we're also not recommending the use of cocaine to prevent it,
No.
regardless of what the research says. Probably not a good prevention plan. And it might actually breed you a few more problems that you don't want. Let's see, Mike, if you could tell the viewers once again the name of your organization, what it is you do, and where they can go to find more information about your work.
Sure. So I founded the Testicular Cancer Society, and basically our mission is just to reduce the burden of testicular cancer, and we really do that, by a 3-pronged approach, like I mentioned, which is increasing awareness, access, and quality of care across the gamut. And we help people from I feel a lump and I'm nervous to guys that are just diagnosed to guys that they might have been diagnosed 12 years ago and have never met someone else that has disease. We can help that, and we also help the caregivers as well. So our main website is just testicularcancersociety.org.
Okay, great. I will include that below for anybody interested that wants to go in and read up and maybe make a donation to this worthwhile work. Brian, is there anything that I haven't asked you that you wished I did, or that you can think of that you'd like to add to this discussion?
Well, I don't know that there's anything that you that I wish you had asked, but I will say that one of the things that helped me a lot was I had to be able to laugh at myself. So I know that I made, I was commenting earlier about how when I was younger and I learned about this, I joked about, guys like Tom Green and who had been diagnosed with it. But when it happened to me, my first thought was, well, aside from, okay, what do I need to do to fix this problem? once I had that going, I said, you know, I could dwell on this and let it consume me and worry that, you know, I don't know what the chemo is going to do. I don't know if this surgery is going to be successful. But what I did was I put faith in the medical team. I followed all of the instructions that they asked me to do, and I tried to inject levity into what I was going through, especially because the people who I was talking about earlier, my wife and my mother, who were helping me through this, they were extremely stressed out about this entire thing. And I wanted them to not worry as much. And I also I didn't want to worry as much. And I felt like their, fears and anxieties could become infectious and affect me. So I stayed jovial, and I joked about myself at my own expense whenever possible, not because I don't think it's serious, but I think that if you can, um, you know, uh, laugh at yourself a little bit for the situation you're in, make some jokes. I think that it helps you cope, So I used comedy to deal with it. So that was something I wanted to add, that I thought, for me anyway, it was helpful, it was therapeutic. And I did it on the shows. I was very public about what happened on Honey Badger Radio. I talked about it openly, and the people who watched us, they cared a great deal about what I was going through, but at the same time, we were able to have a laugh together. So maybe that's just the way I do things, but that was one thing I wanted to say. And the other thing is, I did want to ask Mike this question. I was very concerned about my testosterone levels. Is that something that I should be concerned with? Is that something that is an effect of TC?
Yeah, so looking at different studies, it shows anywhere from maybe 18 to 30% of guys after diagnosis have low testosterone. It's even more towards the third there after you've had as much chemo as you had. Testosterone is somewhat tough because of the huge range of normal. And most likely, unfortunately, they probably didn't check your testosterone before you had your orchiectomy. And even then, it may have been low. They didn't check it, a year before you were sick. So you really don't know what's normal for you. The key is really looking at the numbers as well as what your symptoms are. There's some guys that have a really hard time with depressive symptoms and inability to concentrate and can't handle stress. And they think that maybe there's some kind of, mental defect, or they've developed a depression, and they're not thinking that it actually could be hormonal based. And so that's when we hear those kind of symptoms in guys, we try to, make sure they know, hey, have you gotten your testosterone checked at least? Because, it's a lot easier to correct that and know what's going on physically, I think, than to think, I've developed some kind of mental, disease.
Okay. I can add something to that also, Brian, is somebody, I'm 60, I just turned 61 and have lower testosterone levels than I did in my 30s. And I've availed myself to an osteopath and doing hormone replacement therapy. One of the things that you want to make sure when it comes to testosterone levels is that you're dealing with somebody that actually knows how to read tests and what the important tests are, because there's a difference between your total testosterone and free testosterone. You need somebody who really understands those differences and knows how to treatment. But for me personally, the treatment has been really, really good. They've come a long way with dealing with this stuff. So even if you're having that issue, I don't know how this plays in comparison when the etiology goes back to TC, but in terms of just dealing with a lowering of testosterone, these guys are doing great work these days.
Yeah, the only thing that I'll add, Brian, is that, for younger guys that have been affected by testicular cancer, if they're looking at wanting to father children, one of the concerns is that the testosterone therapy itself can really shut down sperm production. There's also a drug called clomiphene that you can ask your doctor about to see, that's assuming that your remaining testicle is working, that sometimes can be used to increase your testosterone level. without really decreasing the sperm production.
Okay, it's good to know.
Another area of life where you have to sort out multiple answers. That's the medical world. Look, gents, both of you, I want to thank you very much for coming on and sharing your experience. I'm hoping, since we get to make this a permanent record on my channel, that if over the years ahead, if it inspires a few guys who think they might be having problems to go to the doctor just a little bit earlier, that this conversation has well served its purpose. I appreciate you both for your contribution to this. And if there's anything else, if not anything else, I will say good night to everybody.
All good. Thank you so much.
Thank you. And look in the low bar here, the description box, and you'll see the links to the Testicular Cancer Society. And what was that? Check Your Balls?
Ballchecker.com.
Ballchecker.com. Man, I don't know how you'd forget that one. Okay. Thanks a lot, guys. You take care now.
All right.